Good morning. Well, actually, good afternoon, I should say, to everyone here in New York. Good morning to anybody on the West Coast of the United States or Canada. Good evening to those of you who may be joining us from Turkey or Europe or points east. My name is Rashid Khalidi. I am not the director of the Sakib Sabancı Center for Turkish Studies. I'm stepping in for our director, Holger Klein, who is temporarily incapacitated, but fine. Don't worry about Holger, he's well, but couldn't host this session. It's one of a series that the Sabancı Center has been happy to host over this peculiar semester, in which we have been unable to have in-person events, unfortunately, but have fortunately been able to reach out to audiences on both sides of the Atlantic and the other side of the Mediterranean, and in some cases even farther afield. I should mention at the outset that we are recording today's session. It's a great pleasure for me to welcome you all to today's online lecture by Zeinab Azarbadegan entitled Corpse Traffic in Ottoman Iraq and the Birth of Global Public Health. I'll say a few words about Ms. Azarbadegan and a few words about her talk. She is a PhD candidate in the Department of History at Columbia University. Her dissertation focuses on the myriad ways that Ottoman Iraqi space was contested between the Ottoman state, the Qajar state, and the two monarchies, and also the British Empire in the late 19th and early 20th century. She's currently working as a research assistant and co-curator for the Qattan Foundation's Palestine from the Sky exhibition. Let me say a couple of words about her talk. The title is a little unusual. Since the Fourth International Sanitary Conference that took place in Istanbul in 1866, regulating the traffic of dead bodies to Ottoman Iraq became a preoccupation of the emerging global public health regime. Corpse traffic was a long-standing Shi'i practice where the faithful transported the bodies of the dead to be buried inside or as near as possible to the shrine cities of Ottoman Iraq, and as near as possible to the shrines themselves, in fact. The state of the health of the Ottoman Province of Baghdad was constantly tied to what was called corpse traffic in Ottoman and international medical discourses. This presentation that we're about to hear examines the global and local attempts at negotiating corpse traffic, the debates among medical experts, and the travel bans that were imposed from time to time on the practice to show how extraterritorial protections were extended beyond living bodies to those of the dead. We will have a discussant today, and that discussant will be Professor Shana Minkin. Professor Minkin is an associate professor and is also the chair of international and global studies at Sewanee University of the South. Professor Minkin received her BA from the University of Pennsylvania, her MA from Emory, and her PhD in the Joint History and Middle East and Islamic Studies program, just a little further south of here at New York University. Her first book, entitled Imperial Bodies, Empire, and Death in Alexandria, Egypt. You can see why she is the commentator for today's talk, of course, from the title of her book, was just published this year by Stanford University Press. The book shows how the mechanisms of death became a tool for exerting both imperial and national governance. So there's a little bit of an overlap between the talk we're about to hear and Professor Minkin's first book. I'm delighted to welcome both of them virtually, of course, to the Sakib Sabancı Center today. Before I turn the podium over to Ms. Azarbadegan, I would like to take the opportunity to thank the excellent staff of the Sakib Sabancı Center, especially the program manager, Sharon Kim, for designing the poster for today's event and for her incredibly meticulous work behind the scenes, always and everywhere. We would not know where we would be without Sharon. I would also like to thank our audience today for joining us. we're going to enable the chat function so you can communicate your comments and questions. I will read the questions from the chat to her so that she can respond after the event is over. there'll be, there may be an opportunity to ask questions in person, but if there are as many participants as I see, that might be difficult. So I suggest at this stage that you put any questions that you may have in the chat, and I will read them to Ms. Azarbadegan. Okay, I think we're ready to go. So Zeinab, please go ahead. We're very eager to hear your talk.
Thank you, Professor Khalidi and Professor Shana Minkin, and also everybody who's here, as well as Sharon, who worked so hard to make this actually happen. I'm gonna share a presentation with you. First. Is this? Ah, okay. So I'm gonna start by this petition actually, which was written in 1882, where the Muslim subjects of Iranian government resident in Astrakhan in Russian Empire petitioned the foreign minister of Iran, saying that although beforehand the Muslims could send their corpses of their dead relatives from Russia to Iran and the holy thresholds in Ottoman Iraq, the shrines, cities in Ottoman Iraq, the Russian Internal Ministry has just now in 1882 banned the transport of corpses. The petitioners were asking the Iranian government to intervene on their behalf to negotiate with the Russian government to lift the ban. So 29 men sealed and signed this petition, and every single one of them made sure to say that they were Taba'a or imperial nationals or subjects of Iran. The Iranians in Astrakhan, which is at the delta of the Volga River in Russia, were asking the Iranian government to intervene so they could move the corpses of the dead, not only to their own home country, but also shrine cities in another empire in Iraq. And this was the purpose of this was to achieve everlasting happiness, because that was linked to the place of burial near shrine cities, in the shrines or near the shrine cities. The reason that this was actually banned by the Russian government was that in 1882, there was a cholera pandemic, which was ravaging through South and West Asia. And the banning of the practice by the Russians was part of a larger picture of the rise of international public health regime to stop the multiple pandemics of cholera and later the plague reaching Europe. And a lot of these pandemics were going to Europe through actually Russia. Astrakhan was actually considered a city that was the beginning of pandemics in Russia. It had a considerable Muslim population, and so it was not only important because of its substantial Muslim population performing pilgrimages, whether it was the Hajj or the Shi'i pilgrimages, but it was one of the largest metropoles in the region with patterns of internal seasonal workers throughout Russia coming in and out. So that's how sort of it became the gateway of disease, not only to Russia, but also Europe. In a world where pilgrimages were increasingly surveilled by imperial states, as we have seen by a lot of scholars discussing it in the case of the Hajj, corpse traffic also became the preoccupation of global public health regime as a problem, as part of the Shi'i pilgrimages. But usually this has been actually discussed only as a case, as a problem between the Ottomans and the Qajars. So this larger picture of, for example, having Shi'i populations coming from Russia. Russia actually had a large Shi'i population in the Caucasus and also the Indians had a large, the British had a large Shi'i population in India, especially northern India, who were performing these pilgrimages and also corpse traffic. So this was it was in actuality an international issue, but most of the studies that have been done on corpse traffic only focus on this Iran-Ottoman network vector. And the reason for that is that most of the Ottoman regulations actually focused on the Iran-Ottoman border, because it was considered actually that this was the largest number of people passing, the corpses actually passing through to Ottoman Empire. Although there were corpses coming through the Persian Gulf, the regulation was specifically focused on the border. So based on European, and these are the scale of this was huge. If you can see the cemeteries, which were in all of these cities, the ones in Iraq, most of the basically corpse traffic was to Najaf actually, and the Wadi al-Salam, the cemetery in Najaf, which was called the City of the Dead. It is still one of the biggest cemeteries, if not the biggest cemetery in the world. But there were also large cemeteries in Qom and Mashhad, and there was not only internal corpse traffic within Iran into these cities, but there was an international one. So we have instances of Indian Shi'is dead bodies being transported, especially to Mashhad. As well as the the cemeteries, the bodies were also buried inside the shrines, which was even more of a health concern, because people were going for pilgrimage to these shrines. So most of what we know about corpse traffic actually comes from European traveler accounts. And what the picture that they depict is, which you can see an instance of it here, was these caravans of corpses were transporting dead bodies on mules, each mule carrying 2 to 6 wooden coffins with dead bodies in different stages of decomposition. And they were horrified and disgusted, and the picture that's on the poster of this event demonstrates that specifically, which was actually an imagined picture. The guy who drew that picture never actually set foot in Iran or Ottoman Iraq to see what was happening. So while we do not have much information on this practice from the 16th century until the late 19th century, we suddenly have an increasing number of documents in the state archives of the Ottomans, the Qajars, and the British, and also probably Russians on the issue. This is because these states attempted to regulate the practice through controlling their the borders by setting up quarantines and taxing the passage of corpses. I argue that because of recognition of extraterritoriality, this became sort of a preoccupation of states. So it started with sort of a global health issue, but because it was because of extraterritoriality, which extended the imperial subjectivity or nationality, tabi'iyat, onto the dead bodies of the subjects, it became a much bigger political problem. And this was because these imperial states would claim to protect the dead bodies of their dead, not only at the borders, but once it actually crossed the border as well. This became a huge issue, especially between the Ottomans and the Qajars, because the Qajars had extraterritorial rights in Ottoman Empire, and they had gained them through the Erzurum treaties in 1820s and 40s. These dead bodies could claim Qajar protection, and this led to a large number of sort of huge diplomatic activity around corpse traffic beyond just health regulation. So today I want to talk about 3 episodes that these regulations actually came into effect. There are others, and we can talk about them, but I think these are the 3 main ones. The first one is in 1866, during the International Sanitary Conference in Istanbul, which is the beginning of international regulation of the practice. The second one is 1874 to 78, when the Qajars banned the practice. And it's the longest actually ban on the practice throughout the late 19th century and early 20th century. And then in 1896, when you have this idea of a Mesopotamian plague, which was actually the Bubonic Plague, which had become a pandemic throughout the world. In 1866, in the International Sanitary Conference in Istanbul, dead bodies under transfer were identified as vectors of transmission of disease in global cholera pandemics. Despite lack of any scientific evidence. So this was informed by two pillars of prevalent medical two pillars of medical discourse at the time. First, that diseases were not contagious. So they wouldn't be transferred from a sick person to a healthy person. They affected a large number of people simultaneously because of atmospheric, climatic, or soil conditions. The best known iteration of this is the Meissner Theory, which focuses on spread of disease because of foul air. And this actually was considered in case of corpse traffic, because these dead bodies who were in different stages of decomposition being transported did spread like a lot. They were constantly considered described by European travelers as like being very smelly and that was basically and spreading disease because of that, sort of the smell of the air, and that the air was polluted because of these dead bodies. But what was more important during sort of the 1866 conference was that, and throughout actually 19th century, was that in regards to cholera, the environmental factor which was considered for the spread of the disease was not air, it was soil. And this was espoused by the German Max von Pettenkofer, who theorized that while diseases could communicate from the sick to the healthy, it can only happen if there is this specific element, unnamed, undetectable element in the soil. And this was actually linked to Oriental ideas about and Oriental discourses. This would keep the European soil pure. So in Europe, cholera wouldn't actually spread, but it came from the sort of, it was considered that cholera came from India, which is actually true. So it started from India, but it could only spread because the soil was ripe with disease. And it was spreading in India and in West Asia, in Iran, in Ottoman Iraq, because of this problem with their soil. And this was so there was a civilizational discourse around pandemic diseases, especially cholera, and how it spread. And corpse traffic was basically also understood in this context. It was also understood in the context of the fact that the second pillar of scientific thinking, that pilgrimages were the problem, and pilgrimages were considered as abnormal sort of fanatic Oriental practices, and they became the main reason that pandemic diseases spread. And this is started with how the British understood what was happening in India and how the diseases spread in India, and later how it spread globally, and why the Hajj, but also the Shi'i pilgrimage and corpse traffic became a preoccupation of international sanitary conferences. So what happened in 1866, they tried to regulate corpse traffic. There was like a large discussion about it. And what the way that they wanted to regulate it was that corpses could be transferred, but they should be transferred in special sealed and disinfected coffins, only during winter months, from Iran to Ottoman Empire. And this regulation was specifically to be instituted at sort of Iran-Ottoman border at the city of Khanaqin, which is on the Ottoman side. It's a bit, I have marked it in this map. It's a bit higher than Baghdad. And on the other side is the city of Qasr Shirin on the Iranian side. But they wanted to regulated in specifically in Khanaqin. This was not to be, there was no way to implement this. So the International Sanitary Conference did not have any means of actually implementing this without an agreement between Iranians and Ottomans. And that agreement was not reached until 1871. But it did create sort of a blueprint for how to think about the practice and how to regulate it. So in 1871, when the Shah of Iran was actually in Baghdad and Midhat Pasha was the governor of Baghdad, the Iranians and the Ottomans reached an agreement on how to regulate corpse traffic. And they actually went beyond what the International Sanitary Conference had come to do. And it was that they demanded the burial of dead bodies for 3 years prior to their transfer. So what would essentially happen that these would be skeletons, these would be dry corpses. But the idea of transferring corpses in sealed and disinfected coffins also continued. And this created problems. But if you look at this graph, this shows sort of from the data we have, that part which is flat is an average. So I don't have a specific number for what happened then, but the rest of it, it shows the ups and downs of sort of the number of pilgrims passing and the number of corpses passing the border, because the Constantinople Board of Health, which was the Ottoman body regulating the practice, from 1872 started taxing both pilgrims and corpses at Khanaqin, and was counting the numbers. So if you look at the sort of the period between the first two peaks, between 1874 and 1878, you see this like a huge drop. And that was because the Qajars decided to ban the practice. And the reason that they banned the practice, the transfer of corpses from Iran to Ottoman Empire. And this only affected, at the beginning, it only affected Iranian nationals. So there were still Russians coming from the Caucasus and passing through Iran and the border to Ottoman Iraq for the first 2 years of actually this ban. The reason for this ban was not any health or sort of issues or pandemics, but it was political. And this is when the idea of extraterritoriality and protection of dead bodies comes into play. The reason that the Qajars did this was because the Ottoman doctors at the border were disrespecting the bodies of Iranian nationals. And they were prodding them with iron rods. In one instance, a male doctor removed the burial shroud of a female dead body for inspection. So the Qajars were horrified. And the people, as well as sort of officials, were petitioning the Qajar state to do something about it. But what happened was diplomatic negotiations between the Ottomans and Qajars failed, and the Shah not only instated a ban on corpse traffic, but also pilgrimage. So no Iranian national could go for pilgrimage or sort of carrying the bodies of their dead into Ottoman Iraq. But as you see on the graph, the number didn't go to zero. And the reason for that was that the Russian dead bodies were still being transported. And it demonstrated the power of sort of ascribing nationality or subjecthood to dead bodies in this framework of extraterritoriality. And it also, the other thing it did, it brought the scale of corpse traffic into the purview of the imperial states, but also international community. So in middle of the 4-year ban, the Qajars decided that the Russians could not do this anymore. The Russian Shi'i subjects could not pass the border, and they issued a ban on Russian subjects bringing their corpses or pilgrims coming in. Also, like you have another episode in another ban that the Qajars instituted in 1869 earlier. They realized that there were Ottoman subjects in the Iranian lands who wanted to transport their bodies of the dead. This became sort of a diplomatic crisis between the Qajars and Ottomans, because the Qajars did not tell the Ottomans that they had instituted the ban because of public health reasons. It was because of a pandemic. And there was a whole episode with sort of these two corpses which were held at the border, and the people who were carrying them were punished and arrested by the Iranian government. And the Ottomans were furious with the Qajars because they had no idea that this ban was actually happening. So the scale of the sort of the problem started to, not the problem, but the practice was becoming more visible to the states, a practice which was already happening and had its own sort of networks and institutions, social institutions for its functioning. The states were starting to regulate it and understand what was actually happening and who was involved. The other problem that this ban caused, this 4-year ban caused, was that it depleted the Ottoman health organization's pockets. And this created a lot of problems for them. For years, they had to sort of wait for it to, and they never actually managed to build all of the facilities they wanted at Khanaqin. And this was also constant issue with the international community because what was happening at the border was not considered to be enough. Like the Ottomans were not doing enough at the border to contain the practice. So the third episode I wanted to talk about, so when the plague actually comes into place. And in 1896, the plague, which was already an issue not only in China, but also had become an issue from 1860s in Iraq. So there were episodes in Ottoman Iraq, there were episodes of the plague sort of becoming pandemic within Ottoman Iraq. And this was a topic of discussion between the Iranians and Ottomans, because the Ottomans constantly blamed the Iranians for bringing the plague to Ottoman Iraq through corpse traffic. And the Iranians were like, no, it's within your soil, it's within the Ottoman Iraqi soil. So that actually became sort of a global pandemic. Plague became a global pandemic in 1896. And the dead bodies became actually further medicalized during the plague. So while cholera was a huge problem, the plague, because of sort of its signs on the body, there were corpse inspections instituted officially, especially by the British government in India, to see if the person had died from the plague, and so they could dispose of the body in a safe way. And it brought sort of pilgrimages, but also corpse traffic from India, for example, to a halt. And the Russians also, so the Russians and Iranians, everybody stopped the sort of the pilgrimages, but it created a lot of fear. And the reason that there was a lot of fear around plague, rather than, so the cholera was happening since 1820s. It was a global pandemic since 1820s. But in 1896, because effective experience, there was an effective experience and difference between the plague and cholera. The plague was, while cholera was considered a sort of oriental disease coming from India, the plague was considered as sort of coming from the dark Middle Ages. So there was a lot of fear around the plague, and it created a lot of draconian regulations by all empires, which led to riots and fierce resistance by the population. The other thing which happened in between these years is that by 1896, people had agreed that pandemic diseases are contagious, because germ theory was proven, so they understood that sort of the plague probably came from a microbe, and they also had an idea that the transmission of plague was somehow connected to rats and rodents. But what happened in 1897 in the 10th International Sanitary Conference in Venice was that while the international community, which had come to realize sort of the germ theory, rats and rodents, which were mostly coming sort of by ships, they wanted to regulate the practice at Basra. So their focus had shifted from the Ottoman-Qajar border, and they wanted to regulate the corpse traffic at Basra, whereas the Ottoman officials refused to do so. They kept saying that the problem is with Iran, and the problem is with the sort of the border. But at this time, the international consensus was that land quarantines don't work, and they should all be changed into disinfection stations. But the Ottoman Health Organization, which was actually staffed by sort of an international body of medical doctors, refused to do so. And the reason for that, which is you can see sort of in how cholera was perceived, and this is a British comic, but generally generally especially the plague and cholera, were considered to be basically affecting the poor more than affecting the wealthy. And because of the scale of the practice, from sort of the number of people passing through the Iranian border, it was considered that most of these people who were passing were actually poor. They weren't that rich. So they would carry the disease with them. And because there was the other thing which was considered was that because there were multiple famines in Iran, plague was also coupled with famine. So wherever was famine, there was plague, and that was the reason that sort of controlling this border became so important for the Ottomans. And usually, what the Ottomans understood was that the corpse traffic was a result of Persian pilgrimage, not Shi'i pilgrimage. And this shifts in 20th century. They become more aware of what is happening and how that is larger, but the idea stays. That's why the border, the land border, became more important in the way that they were regulating the practice. So the sanitary, while the international community was trying to sort of regulate the Gulf, the Persian Gulf, the Ottomans didn't want to do so, and even it was only until 1905 that they attempted to do something about it, but they never had the funds to actually institute proper sort of quarantine stations or health stations at Basra or other places in the Gulf. So as a conclusion, despite repeated recognition that there was no evidence that corpse traffic was a vector of disease throughout the late 19th century up to the consecutive constitutional revolutions in Iran and Ottoman Empire, it became the subject of regulation and surveillance by the Ottomans, the Qajars, and the international community. The regulations, however, were limited to the Ottoman Qajar land border and specifically to Khanaqin. But it brought what the regulations did, it brought the practice under the purview of the states, and they understood the expanse of it, sort of from which stretched from the Caucasus to Central Asia, South Asia, Iran, and sort of Ottoman Iraq. I still haven't seen a single document pertaining to this practice coming from sort of the Shi'i population in Lebanon. So it was very much sort of going to that sort of the east rather than sort of western sort of direction. It was considered a threat because of the sort of the bodies of the poor and also Qajar nationals, because Qajars is kept using extraterritorial rights and travel bans to control and protect the dead bodies of their nationals. And this actually did not only happen at the border, but it continued after they went into the space of Ottoman Iraq. So there was a lot of protection of the graves of the dead, as well as at the border. But another thing that sort of I would like to just point out is that we saw a petition at the beginning. So, and I talked about petitions also during the sort of the 4-year-long ban in 1874, but petitions were not the only way that the local population were dealing with this with these regulations. There was also resistance. And there was an incredible amount of corpses smuggling, but although the corpses smuggling at the border has been talked about, actually most of the smuggling was happening within the space of Ottoman Iraq. So while these regulations at the border were affecting sort of how the international community was dealing with this, within Ottoman Iraq, the Ottomans instituted this law that if you can only transport the corpses if there is a 12-hour distance between where the sort of body of the dead is and where the shrine cities are. And this created an immense problem for especially the Shi'i population in southern Iraq near Basra, because the distance is more than actually a day's trip. And there was this huge corpse smuggling happening internally in Ottoman Iraq, and the Ottomans could not actually regulate it because the local population knew sort of the ways much better, the roads and sort of waterways much better, and the Ottoman state didn't have the enough manpower to actually regulate it. And there were also outright refusals of sort of the bans. There were cases of people, there's a case, a very famous case in late 19th century of a member of the ulama, Iranian ulamas, saying they did not accept the ban and the existence of the pandemic, and going with a huge retinue, breaking sort of the quarantine at the border and passing from Najaf, going through Khanaqin to Iran and traveling to Mashhad on a pilgrimage, and in the middle actually visiting also the Shah of Iran. And a lot of people died, including his wife. And this was actually a subject of sort of debates within Iran as coronavirus started, which actually his family started responding to this, saying this is like, this is not true. The evidence we have for this actually just comes from the British archives. So I'm going to leave you with this picture where, while the Europeans were so horrified by this practice, once the British took over, they actually facilitated this. And the Iraq Railways, which in 1920s actually had specific taxes and sort of amounts for transferring corpses in all different sort of conditions, whether they were fresh or dry, as they would say. Thank you.
Thank you very much, Zeinab. Let me ask Professor Minkin if she'd like to comment.
Yes, thank you so much. So first and foremost, I'm going to do a sincere and heartfelt thank you to Zeinab for reaching out to me and inviting me to comment on your work, to Sharon for organizing, to Rashid here, and to all of you for joining us. I'm really honored and excited to have had the chance to read your chapter and speak with you today. And my comments are more directed to your chapter, which is a little bit different than what you presented here. You've got a lot of threads. So as I read your chapter, you make an eloquent and very well-researched argument showing that the arguments and negotiations over public health in Iran and Ottoman Iraq were ultimately political arguments connected directly to encroaching European imperial influence, as I read it. You ably show us how the control of the borders between Iran and Ottoman Iraq was not only about questions of public health, but about the classification of the Ottoman Empire and Iran as civilized, right, as worthy of sovereignty in the face of this European encroachment, in the face of how they treated each other's dead. You show us as well how these political public health concerns and concerns of national pride or imperial pride demanded control of one's nationals, be they dead or alive. And finally, as I read it here, you also offer very convincing detail of a global economic network that included not only trade, but the economics generated by corpse traffic. And this is, I believe, right, linked back to these first 2 points here, that public health was a political game played out on the bodies of people, both dead and alive, that traversed between Ottoman Iraq and Qajar Iran. And additionally, you demonstrate that your work is moving beyond established scholarship on corpse traffic with these conclusions, right? You show us that both by moving beyond the border as the site of contestation, and by demonstrating that these questions of public health and corpse traffic were not limited to Ottomans and Qajars, are not even limited to the people on the various sanitary and quarantine boards, but rather you show us that these bodies included, for example, the Russian and the Indian bodies, and that the borders were not borders of two lands, but of all involved stakeholders in all of these tentacles that you lay out for us. And you do so with a really creative array of archives. So the first thing I wanted to say is well done on all fronts, and this was a pleasure to read. What is evident to me is that your research will make a substantial contribution to our understandings of Ottoman Iraq, of Russia, of Qajar Iran, and of these Eurasian circulations, right, of the late 19th century. But it's also very much a work of death studies, right? And as Rashid said, my book, published right before the pandemic began, was also a book of death studies, and hence your kind invitation for me to come respond to your work. So for those of you who aren't as familiar with death studies, right, it's scholarship that is engaged, no surprise perhaps, with death, right? It is a growing and interdisciplinary academic field that seeks to center death as the primary actor in organizing the living, be it politically, religiously, socially, or elsewise. Death and our connection with who and how we die, with what remains of us materially in the form of, say, an estate, or how our earthly remains, our bodies, might be buried or mourned. All of this tells us about connections to the land, to power, to governance, in terms of who has the right to bury, to be buried, to build cemeteries, to document and process the dead. And research that centers death studies thinks about burials, forensics, wills, death certification, buildings of cemeteries, mausoleums, all of this, and caravans of death, right? Very centrally, caravans of death. So many works of death studies, you'll find, will focus on genocides and epidemics or moments of mass death, or others might think about the role of memorials to the dead, or how a nation mourns its famous dead or its war dead. But to my mind, the beauty of death studies is that it specifically pushes us to go beyond moments of mass death and think about the everyday manifestations of governance and belonging via rituals, processing, and care of the dead, right? Dead bodies, mundane, everyday dead bodies, then become both the physical and symbolic manifestations of the dispersion of power and of the organization of political and social community. Who cares for the dead and how they do so has then direct implications on who cares for the living and how they do so. That is what your chapter has done, right? This form of death studies is beyond the Middle East, of course, although for years, the central books in the field, like Thomas Lacour's The Work of the Dead, have been centered on Europe. I can say when I first started exploring death studies, I went to a conference in 2011, the Death, Dying, and Disposal Conference. They actually call it the Triple Ds. So I went to the Triple Ds conference in the Netherlands, and I was one of, I think there were 3 of us who weren't centered in Europe or America over a 4-day conference, and that was it, right? So for death studies, to be emerging beyond the world of Europe and America is incredibly exciting, and your work is a part of this, right? So that this is one of very few monograph-length works of modern Middle East history that center everyday death, right? Not genocides, not war memorials, not only plagues and epidemic deaths, but year-round pilgrimages, everyday corpses, moving bodies, questions of burial as the primary actor of your historical narrative is, to me, inherently exciting, right? This is you're telling us history as we have not yet learned it, and that is really amazing. So with that in mind, I wanted to pull out a few key elements that particularly intrigued me for further discussion, right? You demonstrate in your work the growing interest of European imperial powers in corpse traffic as a facet of their use of public health to foster growing encroachment on the region, right? You say at some point that public health turns into a political problem, but I think what you demonstrate is that it never wasn't a political problem, right? It was always a political thing, and it happens as you write it when we see that the Ottoman and Qajar governments only become interested in corpse traffic with when European powers are more active in the region, right? We see it again, that influence of Europe again, when you note that the various European powers installed their doctors on sanitary and quarantine boards in the region. And I was particularly intrigued as I read your narrative of the struggles over contagion and anti-contagion to think that this was ultimately a struggle between two European doctors on behalf of the Ottomans and the Iranians. And you mentioned their nationality of the doctors almost as an aside. And I would love to see you or hear your thoughts more on this, or what you know about them, right? Were they doctors for hire to the highest bidders? Did they believe in the countries they represented, or were there political calculations of where they might work, right? You mentioned also, almost as an aside in your chapter, that the doctors assigned to Tehran were forced to reveal the motivations of the countries they came from, right? I'm told that completely intrigues me. And I was hoping you might be able to tell us what kind of things were revealed. Who sent these doctors to Iran in the first place, right? How do these doctors that you refer to as representing Ottomans or Irans, yet coming from various European nationalities, how do they get there? The ways in which Europe used, again, another way in which Europe is used with the Ottomans and the Iranians is re-emphasized for us when you quote on the bottom of page 55 in your chapter in the discussion of quarantine and trade routes, that the Russian delegate just flat out understood the Constantinople Board of Health, the CBH, to be Europe itself, right? Those are your words. And so all of this to me is really fascinating. And within this, you also make the argument that we cannot understand the border between Ottoman Iraq and Iran as a bipartite border, that we have to understand it as a global border and a border of global contestation, right? And again, as I read this, this breaks down into both a regional and a broader story. It's a story of global circulation, especially driven home in your discussion of endemic and civilized. Right? That really drove home what is at stake in the global economic trade flows and how the different European imperial actors, as well as the regional actors, might benefit from that trade, and how that trade then becomes the primary concern in articulations of public health. Likewise, you highlight this when you show the British concern with Indian bodies being transported to Iraq, right? You're showing us there, again, a regional movement and a global route. And this is, again, shown, I would say, when you talk about the Ottoman and Iranian governments finally linking up, when they're both more concerned with the British encroachment of the Persian Gulf than they are with their own struggles between who's civilized and who's not, and who's endemic and who's not. At some point, they see this external threat as even bigger than the internal ones, and you show us that change. And you show us that this is a Russian issue, right? Just as much as it is an Ottoman and Persian one. And this was fascinating to me, right? Of course, you began this talk with that petition of Iranian nationals in Iran and coming from a city that's largely Muslim. And it left me wondering, do all the bodies in transit coming from Russia to Iran carry Iranian nationality, however it's marked? Right? Are we seeing a movement of other Muslims out of Russia into Iran? If not, if it's all Iranian bodies, as that petition suggests, why is Russia so concerned with prohibiting? Right? Why isn't Russia just letting them go? What were those negotiations there between Russia and Iran? I would be fascinated to know more of those. And that regional element, I want to say, is also highlighted in the move from Persian pilgrimage, as you tell us, to Shia pilgrimage, right? And and you asked a few times in the chapter, like, what can we make of this move? When the pilgrimage is Persian, I think the imagination of it is that it comes from Iran, and there are implications on the political elements of Iranian power in the face of European empire, right? And on then an implication then on Ottoman strength in the face of this. And yet you show us that by the early 1900s, that imagination is opened up to drop the terminology of Persian pilgrimage and go to Shia pilgrimage. And this to me seems to link in some ways to the regional recognition of the threat of Europe that you noted in that Qajar and Ottoman cooperation, and that could be seen perhaps in Russian acknowledgement of their pilgrims, right? Shia, to call it a Shi'i pilgrimage, opens up the countries who are stakeholders in the pilgrimage and therefore equally stakeholders in European encroachment on those pilgrimages, right? On that traffic. And I was wondering maybe how you understood that. And you asked me to talk just for 15 minutes, so I'm gonna get to the end part here, right? So I also wanted to linger for a moment on the role of the corpses, right? They play kind of a funny role in this chapter, I think, where the discussions are about them. But I found myself kind of wondering a few times, are they the protagonists? Are they the side conversation, right? Your story is a story of international health and how this is linked to imperial economic and political struggles, and how this plays out then in the nascent institutions of global public health. And the corpses are but one facet of this larger fight. The role of the corpses, I will say, comes out a lot more in the talk you just gave than it does in the chapter, and the details of the disrespect and things as such. But what comes out is that the corpses really embody, or they embalm the empire, let's say, right? The empire is embalmed onto corpses, and they become a moving object. The corpse is the empire on the move. So then I kind of wanted to end with a series of questions for you. There's so many elements of this story that interest me. If you'll indulge me here, maybe some of these questions are unanswerable in the archives. Maybe they're answered elsewhere in your research. But that being said, here are some of the things that your chapter made me think about, right? You tell us that some people use their wills to be asked to be buried in various shrine cities, but what about others, right? Did families decide? If yes, was there a mechanism through which families might register a death in one city, then bury their dead in another country? How did that work, right? How did that work? Within it, who registered the dead? This related to that, were all shrine cities the same? And what I mean to ask here is, why would somebody want to cross a border if there was another shrine city nearby? You talk about the length of 12 hours of travel, but if I were Iranian and my father died and wanted to be buried in a shrine city, why would I not just choose a shrine city in Iran? What made me choose various shrine cities? And what did burial in these cities do to mourning rituals if families were then not present for the burial? Did other rituals arise to send the bodies off? And related to this, what happened once the bodies arrived at chosen shrine cities? Were there funerals, right? Who attended? Was there an economy around providing mourners for people from faraway lands when they were finally buried? What do we know about that? And then I was wondering if you have any idea how one might have found a corpse trafficker, right? Did you go to your favorite muleteer and ask for a favor, or was there a network, right? Did you match nationality to corpse trafficker nationality? How might that have worked? You're offering us the corpse, and you're offering it very convincingly, right? The corpse has this bounded space of empire, but we know that worked for the corpse trafficker as well. Like in your anecdote, you didn't share it here, but in your chapter, you have an anecdote about the two Arabs, corpse traffickers who don't understand the rules, right? So I was hoping you could elaborate a bit on that relationship between corpse trafficker to corpse. You know what, I will stop there in the interest of time. I will just end by saying this chapter is solid, it's thoughtful, it's intriguing, it's exciting. It demonstrates very clearly the necessity of considering the global in our histories, and it does so while honoring proactive choices and nuanced possibilities of the local. And that is so exciting. And it does all of that by recognizing that our imagination of taking care of the dead and how we process that is a center player in how we live. And thank you for that.
Thank you so much.
Thank you very much, Professor Minkin. We have a couple of questions, and I know you have posed to Zeinab Azarbadegan a couple of questions of your own. So what I suggest is that I read the couple of questions that we already have, and that Zeinab, you answer all of them one after another as to the extent to which you can. We can go a few minutes over. We're supposed to run an hour. We can go certainly a few minutes over. So let me very quickly read you the questions, which I think you'll then answer all of them together, please, if that's okay. So in addition to Professor Minkin's questions, let me read you one from Trout. That might be Eve Trout Powell, I'm not sure. If so, Eve, hi, how are you? What a fascinating presentation, thank you so much. My question refers to the picture you showed at the beginning. Who were the escorts of the coffins? Who did this work, either in Iran or Russia or Ottoman Iraq or India? My question refers to the figures in that picture. Thank you again, Zeinab. I know you'll have something to say about that. Another question from Thabit Abdu. Hi, Rashid. Cheerful topic, I must say. Here's my question. Caravans bringing deceased Iranians for burial in Najaf is not new. Treaties between the Ottomans and Iranians regulating this were discussed during Nader Shah's wars, as well as during Karim Khan's time. What is the most significant change that occurred during the 19th century? Was it only that health became a major issue? Then from Christian Zurbach, thank you so much for your talk, Zeinab. I was wondering if you could talk a bit more about the quantification and registration of corpses. Does this process become more regulated / consistent over time? Were there significant different protocols in Ottoman versus Qajar records? Were cause of death, place of death before traffic and burial of these corpses noted in statistics? So why don't we, some people are already leaving, why don't we let you answer those several questions, and then if we have more time, perhaps we can take some more. Zeinab, over to you.
Okay, thank you, everyone. Professor Minkin, thank you so much for your comments and questions. So I'm gonna try to go through these quickly. So in terms of sort of what happened with sort of who decided when a body would be moved, and sort of how it would be moved. So, so we have wills at hand, but most of the wills we have at hand are of rich people. And they are very specific actually about sort of, they put aside a portion of their money for a transfer of their body into Najaf specifically actually. If they are much richer, they would ask to be buried in other places, in other shrines. I haven't seen any sort of instance of actually people deciding to move a body on their own without a will, but I'm not sure because the wills are kept with sort of families. Even the ones we have access to they are not usually in state archives. The state archives or private archives are buying them at the moment. Or scanning them and putting them online, like the women's Qajar women in Iran, sort of the website, the Harvard website. So it's very difficult to actually give a sort of full picture of like who is doing this, and sort of to what extent, what is happening to the sort of people who we can't find a will for, but they are being transferred. So usually it is sort of the person who asks for this. Why do they decide to take them across the border and not bury them because there were shrines in Iran, obviously, and because Najaf and the cemetery at Najaf, Wadi al-Salam, has a very special place in 19th century. I don't know how was happening before. By 19th century, it has a very special place in Shi'i thinking about, and this linking between sort of where you are buried would you would get intercession from Ali himself, who is buried at Najaf, to be so your sins would be forgiven, and it was considered, like Wadi al-Salam was considered a piece of heaven on earth. So that was the place to go. And then there were people, if you were really rich, then you would actually get to be buried within the shrines themselves. That cost a lot of money. So not many people would be able to do it, but you have all of the Qajar actually kings except Fath Ali Shah are buried in shrines in Iraq. So either Najaf or Karbala. So it's a matter of sort of money actually, like if you are buried in the shrine or in the, in terms of sort of what it did to mourning rituals and all of that, I don't have enough sources to talk about sort of what was happening. I hope that I would find, I just found a travelogue of an Iranian guy carrying the corpse of his dad. So I'm trying to get my hands on it, and it's very difficult during COVID to do so. Hopefully that would actually shine some light on what is happening in terms of mourning practices. In terms of who was present, so there was this network actually of like, even if there were sort of corpse traffickers like or these muleteers, if there was no relative going with the sort of the corpse, there were these networks, like social networks or unofficial networks of people that sort of people knew that a corpse was coming, because there's so many residents, Iranian residents, and also residents from the Caucasus in the shrine cities in Ottoman Iraq that would be waiting for the corpse to come. And that was actually one of the ways that smuggling happened, because even they knew which corpses would be smuggled, and they would actually sign, like they would forge documentation to be able to bury them legally, but they didn't pass the border legally. So these networks existed, and so those people were present, and they all came from like the towns that the corpses came from. How you would find a corpse trafficker? There are stories that corpse traffickers would like go around cities in Iran and like collect corpses. But it seems that also main large cities had known corpse traffickers. And they would actually sort of would make this trip at certain times and carry the corpses. Also, caravans had corpses. So most of the actually corpses which came from the Caucasus were coming with caravans of pilgrims. They were not just like a caravan, of course. They were coming with pilgrims themselves. So caravans of pilgrims had corpses with them. They usually were at the back of the sort of the caravan. That picture, which also, I'm hoping that this is the picture which also appeared on the poster, the one at the beginning. That is a German picture. It was drawn by...
Zeinab, I don't know if you can put it up so people can see it again,
yes,
please.
Yes.
Sorry, we're going over time, ladies and gentlemen. I apologize, but just so that she has a chance to answer these questions. Please.
So this picture...
Yeah, that's the one. That's the one.
Yeah, so this picture is a German picture. It's wood etching actually by this artist called Albert Reichter, and it accompanied an article by this guy called Karl May, who is one of the most famous sort of fantasy novelists in German literature, and he actually has a book on corpse traffic. So corpse traffic is the main story in his book, but the picture is completely imagined. This is not how corpse traffic happened. It's an amalgam of sort of what Reichter and Karl May could come up with from travel accounts by Europeans. So, for example, you have on the right a picture of a woman walking. That never happened. Women were like on the horseback. They didn't walk usually. Like, that's as far as I have read in the archives. There is the flag, the Iranian flag, the Qajar flag of lion and sun. That caravans did not carry that. The only caravan which carried that was the Hajj caravan of the Qajars, which went from Kufa, like near Najaf, to Mecca. So these caravans did not carry flags. There is a man playing an instrument, like next to the guy with the flag. I have never seen that in any document, honestly, like somebody playing an instrument with a caravan carrying corpses.
See if you can make the illustration a little bigger, the way you did at the beginning, Zeinab, so people can see some of this detail.
Yes.
Yes.
So here, this guy, and also carrying a corpse on your back, that it also did not happen. Corpses were definitely coffins, or they were in sacks. Like because if you're just carrying bones, you don't need a coffin. You just put it in a sack and take it with you. But like carrying a dead body on your back, I haven't seen anything in the archives indicating something like this was happening. So this is completely imagined. It creates this like really dark picture. It's very Orientalist. And yeah, so this is sort of, it's not a reflection of what was actually happening at the time. Sorry, I'm just going to pull up the questions. In terms of sort of what changed in the 19th century, so we know there are instances of this happening, definitely from the Safavid times, even if not earlier. What's changed in the 19th century beyond sort of public health, like global public health, is sort of, and just to say that sort of the Orientalists, the Europeans, are obsessed with the dead body, are obsessed with rituals of sort of non-Europeans surrounding the dead body. There are instances of them comparing the corpse traffic to mummifications of Egyptians. So they make these connections that this was happening all throughout time. And so one of the reasons is that, like, there is this obsession with non-European, with Oriental rituals. And what the change in 19th century is that basically is this idea of extraterritoriality and the protection of these dead bodies across the border, which lead to these bans, and also like the demarcation of the border and trying to control it, although it's uncontrollable because it's so vast, and they don't have enough people or information. Actually, the empire doesn't know, like the state, the center state doesn't know enough about what's happening at the border or these practices. So they are trying their best to control this, but they really can't do it. And that's the sort of the switch. So the difference is like this massive like diplomatic activity, a lot of regulations, but it's utter failure generally. And in terms of sort of what was happening in terms of quantification and registration of corpses, so this changes actually what happens within Iran in terms of sort of how to deal with corpses. Beforehand, you don't have state actually keeping numbers and registers of who's dying where, because mostly people actually usually bury their dead in their own backyards. And then if you had some money, you would transfer it to a shrine in Iran. So, or if you had more money, you would transfer it to Iraq, but the state wasn't involved in this. The networks that were involved in this were actually more to do with ulama who function outside of the state. They would officiate the wills. They would officiate what the muleteer would be doing. So it was beyond sort of the purview of even the Qajar state. And what the negotiations between the Ottomans and Qajars do to show that somebody was buried 3 years prior, there had to be sort of a petition, a piece of paper documentation that the Iranian foreign ministry would actually approve. And that approval would also had to be sealed by a number of people, local notables. A lot of them actually, again, ulama. So they tried to sort of, and that piece of paper had to be shown at the border to the Ottomans that this corpse was buried for 3 years. And this is sort of how you have more general sort of regulation or registration of dead bodies. But the only death registers I've seen in Iran are specifically just about, like in Tehran. I haven't seen it happening in other cities. As they were trying to actually, because Tehran was constantly in a state of pandemic actually. And the way that people would deal with pandemics at that time, they would just leave the city. So everybody would just like leave the city and go and live in the sort of surrounding area. And that created a lot of problems. But there aren't, the numbers and statistics are very hard to come by at this time. And I haven't seen enough on the Ottoman side to actually say sort of whether they were counting this and noting numbers of death. The only way we can figure out what was happening in Ottoman Empire is sort of the numbers. They have a system because they are taxing people at burial that was counted definitely. So but that doesn't include cause of death, as far as I know. They're just taxing, and they are burying people, and we know where they buried the people and where they came from. But that's sort of the extent of it. but there were also illegal burials. So that, again, doesn't show the whole extent of what was happening in Ottoman Iraq. So yeah, the whole point being the state doesn't know enough, doesn't have enough power, neither in Iran nor in Ottoman Iraq. Thank you. I hope I answered everything.
There are actually some more questions, but we've gone over a little bit. Maybe I'll read you the last three questions, and if you can very briefly answer them, Zeinab.
Sure.
One, there are several compliments for your talk. I won't read them. One person says, wonderful talk. Thank you so much. To expand on the question regarding statistics, I was curious which sources you used for the table you displayed and how you chose to engage with the quantitative data. So maybe just tell them the source, the question or the sources. Another question, my question is about tribes living on the Ottoman Iranian borderland. Is there any effect of the Mesopotamian plague in this borderland? And there's one newer question which just came in from Sarah Farhan in Sharjah. Did you come across any reflections of local doctors, be they Ottoman, Iraqis, or Qajars, Iranians, participating in inspection protocols? If so, what were their roles in the process? I've come across references in European travelogues that mention local doctors acting as inspectors of the dead and their living companions, and thought you might have as well. So perhaps very brief answers to those questions, Zeinab, and then I'll wrap up.
Okay, so the sources for the data I showed is from the Constantinople Board of Health, and it records the number of pilgrims and corpses passing and how much taxes they paid. So it's 10 piastres for pilgrims, 50 for corpses. So that's where the data comes from. And that data, as you see, is incomplete because I had to average it at some point from other data from, I'm looking for more, more of their stuff. In terms of tribes on the border, and yes, actually they were they were considered the most problematic when the plague came in 1860s because they were moving and the Iranians and the Ottomans could not say where it was coming from, and that became a problem. And sort of the plague, the second actually Mesopotamian plague, the plague in Mesopotamia or Ottoman Iraq was at Suleymaniya, so a region which was contested actually ferociously between Iranians and the Ottomans. Reflections of local doctors, yes, Iranians were actually very concerned with this, and because they were training doctors from 1855 in Dar al-Funun under Austrian or French doctors, they actually only sent their own people. They really didn't want Europeans to be involved in the state of public health in Qajar, Iran. So even if they were, they would limit them constantly. So they would send Iranians to the border, to Kermanshah, for inspection, to Qasr Shirin, and there was this constant debate about sending more of them to the quarantine stations. On the Ottoman side, again, you have Ottoman doctors. So in 1905, you have Izzeddin, what's his full name? He was the head of the board in Mecca during 1890s, and they transferred him to Ottoman Iraq to deal with sort of all the problems there. And Qasim Izzeddin, that's his name, and he actually writes the best reports about what is happening. He is very knowledgeable, and there are other actually doctors which are sent, local doctors, which are, Izzeddin wasn't Iraqi, he was Syrian, but there were other Ottoman doctors who would come to Iraq and were writing reports to the Ottoman Empire, to the central state, writing about the state of health in Iraq. And after the 4-year ban, all the doctors at the border at Khanikin were also definitely Muslim. So they were Ottoman and Muslim, because it was considered by both the Iranians and the Ottomans that the problem with disrespecting the corpses was because they were either Christian and Jewish doctors, and they didn't know how to respect corpses. So they changed that. And you see their names in the Constantinople Board of Health documents and pension files. All of the names are Muslim names. We can't hear you, Professor Khalidi.
I know, I just unmuted myself. Fantastic. Well, Shana, thank you very, very much for your very useful comments. I think you two have a lot to talk about, actually. Thank you very much to everyone who participated. I'm thrilled to see that we've kept an audience for an hour and 16 minutes, which is 16 minutes more than Zoom fatigue time usually sets in. So you're all to be complimented for your incredible forbearance and patience. I think that the interesting nature of the topic is what kept you with us. Zoom just drives us all to exhaustion. I want to thank again my colleagues in the center who arranged this. And finally, Zeinab, thank you very, very much. You're continuing a tradition of work on health in the Middle East and on quarantines, among other things. I know your dissertation is broader than just this chapter that you've presented, but with Michael Lowe, you've done some really interesting and pioneering work on quarantines and health, and we're looking forward to your dissertation being it's completed, defended, and very soon we hope published. So once again, thanks to everybody. Thank you for participating. Thank you for presenting. Thank you, Shana, for commenting. Goodbye, everybody, on behalf of the Saqib Sawanjeh Center. Bye-bye now.